Hello friends, if you who are someone who is experiencing pain in your neck as well as in your legs, along with weakness in your hands and legs, along with pain that is not only staying in the center but is moving as a sharp shooting pain towards your hand and legs, along with some tingling, numbness or sensory deficit, you might experience or you might suffer from a condition which is called as cervical radiculopathy. So what exactly is cervical radiculopathy, how it impacts your ability to do your day-to-day tasks, and what is its management from a physiotherapy point of view? We are going to discuss all of that in today's video. So make sure to watch this video till the end. Let's begin. Friends, cervical radiculopathy is basically a condition or else a problem where there is compression on a nerve root level. Now what is a nerve root? So we have a spinal cord which starts from your brain, drops down, and at each level there are some branching out of nerve roots that happens. These nerve root then divides into nerves and supply to different parts of the body. Whenever the nerve roots are getting compressed or if the thicker nerve ends are getting compressed, that particular nerve area which is being supplied or is being functioned based on that, you will experience symptoms. Now, in cervical radiculopathy, either due to or degenerative changes like cervical spondylosis, where there is degeneration at the joint level which leads to formation of bony spurs, or else bony sharp structure which compresses or pinch your nerve on a constant level, at that time you will experience symptoms of cervical radiculopathy. Or else if there is a disc herniation where the disc which is present between two vertebrae is getting compressed and is getting oozed out or is getting herniated, that compression will lead to symptoms of cervical radiculopathy. Cervical radiculopathy basically stands for a radiating pain that is present due to compression at the cervical level. Mostly cervical radiculopathy happens at certain levels of cervical spine, which is C7, C6, C8, C5, C4, C3 level. But the most commonest area of cervical radiculopathy is C7 level. C7 and C8 level. This is the most commonest of all other areas or levels of cervical radiculopathy. Now, depending on at what level the cervical radiculopathy or else the nerve compression is happening, you will experience symptoms accordingly. Now, the most common symptom that a person will experience who suffer from cervical radiculopathy would be number one, pain that is not only staying in the center of your neck region but is radiating to your hands and sometimes is also radiating on your back, upper back and one side of the body and even the leg area. This pain is very dominant in the arm region compared to other areas of the body. Along with this pain, there would be tingling, numbness and consistent feeling of a numb sensation or something that is tingling or pricking around your hand would be felt when a person suffers from cervical radiculopathy. And the other common symptom is sensory deficit. A person who suffers from cervical radiculopathy also experiences sensory deficit following this problem. And the last symptom that is common following cervical radiculopathy is muscular weakness and inability to perform day-to-day tasks with the hand which is affected. And that's why person who suffers from cervical radiculopathy find difficult to do some key day-to-day activities like lifting a bucket, writing with pen, driving, etc. This all is because of cervical radiculopathy. But if you are someone who is experiencing all the symptoms, it's not necessary that you have only cervical radiculopathy. There are other conditions as well which will give very similar symptoms as of cervical radiculopathy. These conditions are tumors, systemic diseases, vertebrobasilar syndrome, cervical myelopathy, ligamental instability, shoulder dislocation, peripheral disorders like diabetic neuropathy, thoracic outlet syndrome, brachial plexus injury, etc. Now, all of these conditions might give you a very similar picture, and that's why diagnosis becomes a very crucial part. Hence, if you are someone who experience all the symptoms like pain in the neck followed by shooting pain towards the hand or its arm region which is not being controlled for more than 7 days, if you feel tingling, numbness in your hand, if you feel that the strength of your hand is reducing And if you feel that you are not able to sense cold, hot, fine touch, deep touch, pin prick kind of sensation, definitely you should see a doctor for a right diagnosis. Diagnosis is usually made based on history, physical examination, special test and some other tests like MRI, CT scan, nerve conduction velocity test and EMG test. Based on all of this tests, doctor comes to the conclusion whether it is cervical radiculopathy or not. Now coming to its management, there is medical management for it and there is surgical management for it as well. But it is usually kept for a more severe scenarios. If you are someone who has just started experiencing the symptoms, physiotherapy would be the first preference of your doctor. And that's why physiotherapist is someone who can help you to solve this problem. Physiotherapy basically focuses on following things. Number one, education. Yes, education plays a very crucial role. It's very important for you to understand what exactly is this problem and what is the nature of this problem. Because when you understand that, you would be able to do your lifestyle modification. Because lifestyle modification would be the key and the most crucial part to manage your cervical radiculopathy. And then comes the next step, and that is lifestyle modification itself. The way you sit, the way you stand, the way you walk, the way you sleep, the way you work, all matters and requires modification in a way that puts minimum amount of compression on your cervical spine. And that's why posture correction is the key. So your physiotherapist might suggest you a change in your workstation, change in your pillow, the change in your chair, etc. so that your posture stays in a much more aligned manner. Along with your posture correction or a lifestyle modification, exercise plays a very crucial role. Exercises are usually started from simple gentle range of motion exercise to more of long-term stretches, which also involves nerve loss, along with some strengthening program to improve flexibility, strength and movement around the cervical and shoulder region. Sometimes some physical modalities as well as some physical methods like manual therapy is used to reduce the symptoms that can persist or come repeatedly over a period of time. But combination of all of these factors will only make sure that you are able to sustain and live a very good lifestyle without much of symptoms when you suffer from cervical radiculopathy with this method. So, if you who are someone who is experiencing cervical radiculopathy, make sure to correct your posture, talk to a physiotherapist and your doctor to understand your problem and do your exercise on a regular basis so that you can overcome and maintain a good lifestyle living with cervical radiculopathy. In upcoming videos, I will definitely make some videos for exercises for cervical radiculopathy. So if you are interested, make sure to let me know in the comment section below. And if you also want to know furthermore in-depth information for cervical radiculopathy, make sure to comment them as well on the comment section. I would love to hear them out. On that note, I'll end this video here and I'll see you in another video. Thank you.